Welcome to the Patient Safety Series May webinar. Thank you everyone for joining us. This is our third session in our webinar series co-sponsored by the NNLM South Central Region and the University of North Texas Health Science Center Institute for Patient Safety. We are thrilled to continue bringing these expert guest speakers to you in the hope of empowering healthcare professionals, patients, and health information professionals to support the elimination of preventable harm and achieve the highest quality in healthcare possible. I'm very excited to introduce today's guest speaker, Jessica Mac Rangel. With over 30 years of experience in the medical field, Jessica has served as an innovator for the patient safety, high reliability, and patient advocacy environment at both the local, national, and international levels. Creating patient safety and advocacy curriculum for international implementation, Jessica has promoted an interprofessional approach to improve patient care and family outcomes. She is a master's prepared registered nurse who is recognized academically through Sigma Theta Tau International Nursing Honor Society, along with multiple leadership and patient safety awards. Jessica's expertise is also reflected in her former career as the patient safety officer for both very large corporate acute care systems and acute care facilities. She has served on several advisory boards, most notably National Quality Forum, Medication Safety Subcommittees, and the Professional Patient Advocate Institute Advisory Board. She is a member of the National Patient Safety Foundation and American Society of Professionals in Patient Safety. She's also a published regular contributor to nursing textbooks, as well as having numerous articles regarding leadership, patient safety, and advocacy, currently serving as a senior fellow nurse executive at the Institute for Patient Safety at UNT-HSC. She still maintains her master trainer team steps, master change agent, and change acceleration process status. Jessica obtained her Bachelor of Science in Nursing from Armstrong Atlantic University and her Master's of Science from Mountain State University, after which she trained in evidence-based practice. She served as a clinical instructor for both nursing and advanced paramedic studies. Her early career included Level 1 emergency department nursing, flight nursing, and neurotrauma nursing. Jessica continues to be a passionate advocate for the elderly and underserved. And with that very impressive resume, I'm overjoyed to have Jessica actually physically here in the room with us at the UNT Health Science Center. I'm going to go ahead now and hand things over to Jessica and let her get started. Good afternoon, Jessica.
Good afternoon. Thank you. Thank you for that introduction. I'm actually sitting here blushing and you all can't see me, but thank you very much for joining us. I want to thank you all for taking this time to listen to my discussion, opinion, and experience on tipping the culture in healthcare regarding mass communication and how it impacts perception. And I'm thrilled that you chose to join me, and I recognize that many of our colleagues on the line are not clinical, but please know this does not preclude my non-clinical partners from having equal impact on this topic. In fact, I encourage everyone's input. So as we go through the discussion, as mentioned, please do ask questions, comments, add to the discussion. I really look forward to that because it's through this kind of exchange that we can explore innovative ways to improve the culture of safety. Can't get it to change. We're going to the next slide. Thank you. The objective for today is just consider that we might have an opportunity to communicate differently to the masses. And by the masses, I mean our staff, our providers, and if you are not in healthcare, just whoever it is that might be listening to you. But let's just consider, do we have an opportunity to communicate in a way that encourages transparency, safety, patient safety, and thoughtful exchange of ideas? As leaders, there is an imperative to convey healthy vision with every communication we publish and everything we speak. I think we're missing the boat in healthcare, and it may take some authentic transparency of our vulnerabilities to rectify the issue. So my disclosures first, I do not pretend to be an expert in aviation, nor do I pretend to be an expert in nuclear power. But I do, however, have many friends that are, and were consulted in this discussion that I'm having with you today. So my first hope is that our discussion would be thought-provoking. Despite any limitations I have or opinions, I hope it makes you think. I hope it moves you to action and shuns any essence of complacency where it involves your culture of safety, because that's where it all begins. Take it personally and let it move you to change. Let your intention be clear. Know that I subscribe to the interprofessional approach to feedback, knowledge gathering, and communication. I need my public relations partners, my media partners, my librarian partners, and other colleagues to present me with knowledge of which I was unaware. Guide my communications, give me feedback on what I'm saying, and to redirect me when my intention is not consistent with my message. I wanted to begin this discussion with the second quote, actually, by Peter Drucker, who's an Austrian-born American management consultant and author, who shared his learnings and philosophies around foundational business management. But this quote really struck me. Quote, "The most important thing in communication is hearing what isn't said." So as we move forward with this discussion, please keep this in mind, because I want to share with you a story that illustrates this conundrum of communication and intention. And it's just a small illustration of what is occurring throughout healthcare, and I feel pretty certain you probably have several yourself. So I have two friends, and they're both exemplary nurses who work at two different institutions of healthcare in two different states. One had been notified of a Joint Commission survey visit, while the other received notice of a Joint Commission validation survey. So I've been in healthcare over 33 years, and I can tell you that despite any level of readiness, the notification that Joint Commission is on your doorsteps gets you a little anxious. And so a little background for those who may not be familiar, Joint Commission is a commonly used accrediting organization that's approved by CMS. Achieving accreditation through Joint Commission means that the healthcare organization has been deemed to meet or exceed standards, and therefore they can receive payment for Medicare services provided. Their standards are truly focused on patient safety, and the surveyors, they are interprofessional, they're well trained to verify all aspects of safety. But that noted, when they do show up at your facility, it's to verify that your healthcare organization is abiding by these standards of patient safety. So as a consumer, that is a great thing. But having been that nurse when they arrive, it's a little different. So back to my story. What impacted my friends and I the most was the mass communication that was sent out by both the healthcare organizations, separately owned, by the way. And it was regarding how to work with surveyors, and it was sent to all staff and physicians. And I bet this won't surprise my healthcare partners out there. One entity communication states verbatim, "Don't offer any more information than is asked." The other mass communication informs staff to stay busy, don't engage unless you're asked to engage. And there are advisories and blogs that I found and have received regarding Joint Commission visits that advise patients from their physicians to leave if Joint Commission arrives. Joint Commission, although for sure they're armed with the ability to declare immediate jeopardy if they see something that could endanger patients, and they can remove your deemed status as a facility if there is a failure to abide by standards intended for patient safety. But let's not forget, they're there for patient safety. So take a look at these quotes and ponder for yourself, what intention do you read from them? So how about the stay busy? Don't engage surveyors unless you were first engaged. That's from a healthcare organization. Only answer the question asked by the surveyor. You do not need to elaborate. Another healthcare organization. Don't volunteer additional or unnecessary information. So what are we communicating? When we share mass communication that gives us a list of don'ts, I can tell you through numerous Joint Commission experiences that this is exactly what organizations are communicating, yet, here's our contradiction, we claim to be advocates and patient safety organizations that take patient safety very seriously, and that this is our primary core value or something along those lines. Really? I really challenge that. And I digress to the quote, the most important thing in communication is hearing what isn't said. So I hope you're a little uncomfortable right now. Look at this. Put some fresh eyes on. Reach out to your interprofessional partners and ask, what does my message convey? Was that the intention you were aiming for, or the converse? What is my audience hearing that wasn't said? Are we telling staff and providers that patient safety isn't as important, really, as we once said it was? Or are we setting up adversarial relationships with our auditors who are only here for patient safety? Are we indicating that we have something to hide? Because that's the message many are receiving from leadership. So let's take a little quiz to illustrate where we are in healthcare with regard to safety and why this is such an important message for all of us. So here's your quiz. Place the following activities in order of safety, and how would you rank them from safest to least safe? So I can tell you the fourth item down, driving, it certainly depends if you're my teenage daughter driving or not. So that aside, let's look at it overall and I'll tell you what the results are. Here are your results. So Dr. Lucian Lee, considered by some as the father of patient safety, created this to show how healthcare safety performance compares to other high-risk industries. So this chart demonstrates that you'd have to ride a European railroad a whole lot before there was a fatality. But yet, look at healthcare, and I think we've got a way to go. So why are we not moving the mark in healthcare? We have invested so much time, energy, and resource into improving patient safety, and we're still not there. Well, what might make these other high reliability organizations do that gets them there? And have we something to learn from them? So think about some high reliability principles and know that when they're permeated throughout an organization, it leads to better cultures that promote patient safety and safety all around, which includes staff and employee safety. So when we take a deeper dive into high reliability organizations and what they may be doing right with regard to communication, we might be able to learn from them. If you're unfamiliar with the term high reliability, let me explain it just a little bit. It's a science around organizations and industries like commercial aviation and nuclear power that operate under hazardous conditions while maintaining safety levels that are far better than those in healthcare. These industries have infused 5 different concepts into their cultures. They've hardwired them and continuously evaluate them. And although errors, unintended adverse events, and mishaps do occur, these concepts infused in the culture create a resiliency within their culture. So Wyke & Sutcliffe's book, Managing the Unexpected, is a brilliant read and is the source from which I share these concepts with you. Brilliant concepts, but let's look into how the high reliability organizations actually communicate. So I did some research, and to begin, look at this one that I found directly from the Federal Registry regarding messaging. The opening line to the Nuclear Power Pocket Guide for Staff even states in bold this very value. Nuclear safety culture is defined as the core values and behaviors resulting from a collective commitment by leaders and individuals, and this is my favorite part, to emphasize safety over competing goals to ensure protection of people and the environment. That is powerful stuff. So tell me, is this not a meaningful message to all nuclear power employees? And is this not meaningful to leadership? And what does this say to you? Are you picking up a clear intention? Because I sure do. And even with aviation, they communicate a similar mantra in various materials that they have. Safety management must be based on the behavior of people and the organizational culture. Everyone has a responsibility for safety and need to participate in safety management efforts. System safety management adopts techniques of system theory, statistical analysis, behavioral sciences, and continuous improvement concepts. Two elements critical to this modern approach are a good organizational safety culture and people involvement. They are encouraged to identify hazards, unsafe acts or conditions, identify at-risk behaviors, collect the information in a readily available format for providing immediate feedback, train frontline people to implement and take responsibility for day-to-day operation of their programs. And both of these examples are but a single message in a host of many that are direct, intentional, and to the point. So while doing an informal gap analysis on my own, I was intrigued to see how aviation and nuclear power deal with similar scenarios regarding intention and messaging around safety audits. And so given that they are both industries that involve public safety, you'll be delighted to know the degree to which they instill safety first in their culture through their mass communication. So let me share with you a little bit about what I found. If you look at that first line, I'm looking at how they compare with regard to measuring across each of the industries, and you can see that for yourself. What kind of feedback do auditors provide? And basically, they typically provide the same thing with an opportunity to rectify any errors that they have found or violations. What was very interesting to me was in that third category, where they examine responses to errors that have not resulted in an incident. Like how does each entity or each, industry examine errors? And they look at them differently. I thought that was very interesting. The next category under what happens if something is found, what kind of feedback is given to the staff. Aviation, crews are not at risk for receiving reprimands under non-jeopardy conditions. And I like what it says directly under that of an unannounced audit, that I found a quote in their literature that said, establishing that there is a non-punitive policy toward errors during data collections improves validity of the data by encouraging those being observed to carry on their natural work behaviors. And in fact, we all know there's a Hawthorne effect that people behave differently when they're being observed. But that being said, if the individual knows that they will not be individually held accountable for sharing information or bringing a concern up, I think that changes the game. So when we look at nuclear power safety audits, what I found most intriguing was the piece around the open dialogue with their auditors. And I put there in red chilling effect, and we're going to talk about that on the next slide, which I think is something we could learn quite a bit from, where questions can be asked from the surveyor or the inspector to the individual that indicates what kind of communication is going on within the organization. So if we go to the next slide. So listed here are questions that a nuclear safety inspector will ask during an inspection or could ask that would indicate there are some behaviors that may discourage reporting of safety issues or bringing up concerns. So if you look at this, this is so interesting to me that you look even the first question. Tell me what specifically happened and when that impacted your or others' willingness to raise safety concerns. What types of concerns are you hesitant to raise and why? And what do you think the impact is on safety? And to whom are you hesitant to raise safety concerns and why? An important piece for leadership to be keenly aware of. Who is contributing to the chilled work environment, and what is his or her relationship to those who are chilled? Do you believe management is aware of the chilled work environment? And if yes, have actions been taken to address the situation? And do you feel that the actions have been effective? So I think this line of questioning is really messaging a core value of what is most important, and that is that you have an individual responsibility to bring up the concern, as well as leadership has a responsibility to respond to that. So what if a healthcare organization would ask the same of frontline staff? Would that not be a powerful message to everyone? And does that not demonstrate that the messaging indicates that safety is an imperative and taken seriously? The chilling effect is not tolerated in that industry. So let's talk a little bit more about that, and let's look at a recent catastrophic event that may demonstrate more messaging and issues and impact on safety culture. Well, as you may already be aware, we had a catastrophic event on Southwest Airlines Flight 1380, and this was on April 17th of this year. And the aircraft was at 32,500 feet en route to Dallas when the left engine exploded and broke a window on the 17th row, killing Jennifer Roden. They made an emergency landing in Philadelphia, where 7 other people were treated for minor injuries. So this quote before you came from a report published on May 3rd. Months before an airborne accident claimed the life of a Southwest Airlines passenger, the Federal Aviation Administration found that distrust between managers and mechanics at Southwest Dallas Maintenance Base was so bad, FAA investigators feared it could put passengers at risk. So I wanted to clarify, however, that just because this is quoted from a news organization, it does not verify that distrust is the cause of the event. Sometimes messaging can imply causation when in fact that's not the case at all. And in fact, we may never know what the real cause was. But this messaging may be perceived as implying nefarious behavior around this incident, and it may be completely untrue. So even in a highly reliable environment, adverse events still do happen. And the National Transportation and Safety Board is the investigative arm in incidents that seek the root causes of adverse events or incidents so as to prevent them from happening again. But it is still troubling to read an implied culture of distrust between leadership and frontline. But let me submit to you a thought that applies to all these industries along with messaging, and that is that messaging or communication perception impact culture, which impacts safety, and that applies to any industry. So Dr. Mark Chasson presented at a conference in 2010, and he shared some profound thoughts on a safety culture. He quoted Dr. James Reason, the professor of cognitive psychology and human factors and designer of the Swiss cheese model of error, and he looked at all of this work on high reliability and condensed the idea of a safety culture into 3 imperatives: trust, report, and improve. And you can see these are foundational to a patient safety culture with leadership at the top. And for more information on this, I really encourage you to review the ongoing quality improvement journey, Next Stop High Reliability by Drs. Chasson and Loeb. But trust, report, improve. And I think it's time for us to examine if we are promoting trust in what we communicate, both in print and spoken word. And it doesn't take much to undermine trust. which undermines culture, which impacts safety. People don't feel free to report or raise a concern if trust is lacking, and then we lose the opportunity to improve. I submit that when we send out messages like don't offer any more information than is asked, or stay busy and don't engage surveyors, that we are undermining trust for which patient safety pays the consequence. More specifically, those we love who are in the hospital will pay that cost. In nuclear power and aviation, any incident that happens with them that involves harm is widely publicized, and your evening news is always on the ready to capture any such mishap. Yet, it's really rarely the case in healthcare. So this slide is demonstrating that medical error is the third most common cause of death in the United States. And this is so unbelievably troubling to me. We have a lot of work to do. I remind you of the three imperatives of a safety culture again: trust, report, improve. Trust can be a very difficult journey, especially if our messaging is askew. Trust is a firm belief in reliability, truth, and ability. And as a leader, does what I communicate in written and spoken word convey a truth? Is it consistent in its message? Does it convey the intentionality that was desired? Am I harming or supporting a transparent culture of safety with what is being messaged? My hope is that you would consider these questions when you have important messaging that has to be conveyed. So I wanted to share a couple of parting thoughts. Communication perception will impact impact culture, which will impact safety. Please bounce your messages off one another to verify if the message is consistent with organizational values, and if the message is received in a manner that it was intended, and if it supports a strong culture of safety. If it doesn't, change it. Trust, report, improve. The three imperatives that a safety culture needs to continue. Is leadership messaging in such a way that is in line with those three imperatives? It's an important question to ask. And then welcome your inspection partners. Okay, I know this may run a bit counterculture, but consider this. If in fact you and your leaders have been working, messaging, promoting, and supporting a culture of safety, do you have anything to hide? Do your organizational values sync up with organizational actions? Are you and your leadership proud of the organizational accomplishments to provide the safest environment for your patients and staff? So I challenge you to vet this through your organization. Let fresh eyes tell you how you can make practice safer for our patients. And finally, always involve your interprofessional partners. In ongoing literature reviews that they can bring you best evidence-based practice that will support your messaging and to support practice change and to support your culture of safety. And there's absolutely no need to reinvent the wheel. Nuclear power and aviation are wonderful partners from which to learn. See how they all message and learn how they convey a non-negotiable priority of safety in their culture. Not perfection, but yet they strive for it. So thank you for your time and attention on this topic, and I'd love to continue the dialogue. So I've included my contact information, so should you desire to carry on the discussion or you have some other thoughts. I really welcome it. I think we have a real challenge before us, and we have an opportunity to do something about it that will result in some true, authentic changes in our culture.
Wonderful. Thank you, Jessica. We'd now like to open it up for any questions or comments if anyone would like to enter those into the chat box. We have plenty of time to address them and think about today. As people are thinking, I do want to start with an initial question, Jessica, for you about how to improve that trust. What do you think is the best way to go about improving the trust that exists?
That's a great question. It's really the million-dollar question. And I think it begins, as we spoke earlier, it begins with being authentic with everyone, providing a vision and being consistent with that. And I think transparency is just a true element of that. And over time, that does build trust. Staff know that if there is a concern, they can bring it up without fear of a reprimand that they even brought something up. It's important, and I'm a huge advocate of a just culture. It doesn't mean it's blame-free. It means people are still held accountable, but in a very healthy sense. So I think your question is valid, and I think that that's something that all of us are striving to figure out within our cultures. But I would say foundationally, transparency and consistency would get us there.
Great, thank you. All right, hopefully people are typing their questions, and we may have some very long comments coming as we wait for those additional comments. I actually did have someone ask a question when they heard about your topic, Jessica. They were curious to know, in a situation where there have been changes to healthcare, maybe updates and the standards have been changed, what's the best way to go about educating the workforce? Because those changes that you try to make as a leader could be seen as the wrong thing, and so then you would have the opposite problem, right? Reporting things that are actually going in the right direction, but you have your staff reporting you. So what would you suggest in that kind of situation?
Well, a lot of organizations advocate, and I certainly agree, with rounding, executive rounding. I think that's how you keep the communication lines open, so that when there's this authentic exchange of information and from leadership authentically receiving concerns from staff, I think you can really level set what changes are happening, how is that going to impact them, does it make sense? There's nothing that truly can replace that face-to-face interaction. And again, from a patient safety perspective, I think it is truly one of the primary ways to get that message across. And that's, again, rounding with staff, getting to know them. Let staff know who executive leadership is, and that applies to any organization. Nothing replaces that. I think other forms of communication are still very, very important, but primarily that face-to-face. It's a good question.
Okay, thank you for that. All right, well, as we wait for further comments, let's see. What you're thinking is the next step, Jessica, in this continuing the dialogue, continuing this discussion? What do you think the next big change should be for healthcare?
Well, I think the next big change for healthcare with our organizations to improve patient safety along with messaging, it really has to start at the level of our Board of Trustees. They are truly the ones who allocate resource and collaboratively set vision and direction. And at that point, when it becomes very important to them, they, in combination with their various C-suites, can implement a culture that truly is working in this direction. When I look at aviation and I look at nuclear power, I was really struck how there are a lot of governmental statements that this is going to be the core value, this is how we're going to operate. And not to say that healthcare doesn't have some of those very same things, but I just found that even at the highest levels within our government, the message is very clear. This impacts patient safety, or excuse me, this impacts public safety. And I think we have to take the same mentality when it comes to healthcare, is that this is not just about our organization, it's about the greater good. And my dream would be that Joint Commission or whatever accrediting body and organization would choose, that when they present on the doorstep, it would be a welcome partnership of, come on, let's show you what we have in place based on these standards that you have set up for us, but we want to show you what else we've done. So I think that would be pretty phenomenal if that could happen.
Oh, great. We do have a question regarding the Joint Commission. Does Joint Commission know that these communications, the don't offer more than once asked, et cetera, do they know about them, and do they have rules about those communications?
That's a good question. Many of the surveyors that do survey for Joint Commission are actively working in these organizations. So I suspect that all of them are very well aware, because most of them are quite experienced and frankly experts in their field. So they are aware of them. And do they have rules for not doing this? There are no rules. There are no rules relative to that. One could surmise it has something to do with impacting their culture of safety, but again, it's not, I think nuclear power and aviation are more of a model that maybe healthcare needs to follow.
Okay. Thanks for the question, Brian. Other questions, other comments, thoughts? We'd love to hear them. Go ahead and write them in the chat box, please.
Or frankly, if people are more comfortable, they're welcome to email me. I invite the discussion, and we can take it to the next level. Looking forward to that.
Great. All right. Well, unless anyone is typing right now, I think we'll go ahead and wrap it up for today. I do ask that everyone stick around just a few moments longer for some final housekeeping. But of course, we want to give a huge thank you to Jessica for a wonderful session today, and for being so willing and open to talk further amongst people. If you do have any questions that you're not quite sure how to formulate that, we do encourage you. Jessica's shared her email address here on the screen. It is in her slides. So thank you, Jessica, for such a great presentation.
Thank you very much, and thank you, everyone, for participating.
All right, I'm going to go ahead and stop the recording, and then we'll move on to some final housekeeping. So just a few moments, everyone.